Okay, I think we'll kick off. So good morning, good evening and good night, depending on what part of the world you're joining us from. I'm speaking to you from Dublin, where it's just past midnight, but I've had plenty of coffee, so I hope to make it through the hour. We've had a great response to the webinar from investors, the investor community, from our customers and the healthcare community, and we're really delighted to have so many people on the call today. I'd just like to start by welcoming Mike Mainiero. Mike is the Senior Director for Digital Strategy and Innovation at NYU Langone Health in New York. And NYU Langone have just been named in the US News Best Hospitals honor roll for 20 and 21. They were there last year as well. And it's really our privilege to partner with Mike and the team to support their inpatient digital strategy. And there is a tropical storm hitting New York at the moment with power outages, and so we really appreciate Mike joining, and he's on his day off as well, and we hope that the power and the phone hold out. So just before I hand over to Mike, I just wanted to give a very, very quick overview of Oneview, just to give context. I'm sure we've got some new folks to the story on the call, so just to kind of orientate everyone to the company and what we do. Let me just skip through the slides here. So we provide digital tools for patients, for families, for caregivers to improve the care experience. And by unifying hospital systems, content, services onto one digital care experience platform, we help providers enable patients and families, deliver virtual care, optimize patient flow, and standardized care with dedicated touch and TV devices at the point of care. We partner with leading healthcare systems in the US, Australia, the Middle East, and Asia, including 3 of the US News top 20 best hospitals. So that's another 2 in addition to NYU Langone Health. We've got over 9,000 beds live. We're listed on the ASX, obviously, and we have offices in Australia, in the US, and in Dublin, Ireland. And much as I'd like to think that you've joined to hear me, I suspect that you're really interested in Mike's perspective as a customer. So Mike, thanks so much for joining us, and over to you.
Thanks for having me. So I'm just going to give a brief overview of my role in NYU Langone Health for some perspective. And I want to get into sort of 2 stories. One is our initial implementation of Oneview Health, which was 2 years ago. And then I want to tell a little bit of the story of how we've been using it during the pandemic and really gearing up to post-pandemic and really building innovation to scale, if you will. So my name is Michael Mainiero, as I was introduced, and I've been heading up digital health for NYU for about 19 years, and in the digital health space with startups for a little over 20 years. And my role is essentially all things patient digital experience, research, education, and workforce. So I cover all the missions. And really what I do is I lead transformation and experiences. And this product is really one of the cornerstones for me and our organization for the inpatient digital experience. So there's a lot of ways that hospitals will think about this. And I'm going to sort of try and get into that a little bit. But next slide, if you can. I don't want to bore you guys with accolades and such, but I think it's important to stress, we really are, we have 5 hospitals now, and we've really over the past 10 years been a data-driven analytics hospital with a really strong leadership backing in innovation and technology. So we've got a tremendous amount of support with the ability to do things and sort of innovate where needed for patients from a patient-centric standpoint. And we just got ranked number 9 in top hospitals. For us, these are accolades. There's many views into this, but for us, that's a marker of such that we are operating at a high standard. And this really attributes to quality of safety and patient experience, and of course referrals and other physicians, what they think of us. To us, when we do something like the inpatient digital experience, we believe that a lot of what we do affects this as well. So I think, if you could just go to the next slide, to give an idea of where our focus is, for us, actually, Dr. Birnbaum on the top left was one of our sort of leading physicians who passed away a few years ago, but he really started this whole excellence in patient-centered care, which kind of kicked us off into thinking about how do we deliver things in a way around the patient and not just what the doctors ordered, right? So this is sort of storytelling into getting us how we started to think even about a product like Oneview. And we do win the Vizient Award for patient safety and quality. And nursing is also very strong. I will talk about that for a bit, and such that you can't have a system like this without really thinking about the nursing experience and the clinical experience. So for us, awareness is really important into these types of things and how well our clinicians and patient outcomes are affected by systems. So it really is a total ecosystem. Next slide. So this is just a footprint. If you guys are familiar, this is a pretty popular part of the world, I would say. It's the map of, you can see Manhattan's very small there, and you've got Long Island stretching. And what this shows is we have 400 locations, and really ambulatory sprawl is a thing, and that a lot of that has to do with how the healthcare payer structure is, but having a lot of locations where people can geographically come to is important, but it also plays out into the strategy for how we roll out a software or a system like Oneview. So I'm going to talk a little bit about that as well. Next slide. And just by the numbers, we see, these are about a year old. So we see 8 million outpatient a year. Obviously with COVID, a lot of these shifted. However, we are still seeing we're back up to very high volumes for inpatient and for ambulatory visits as well. And our digital online presence, which our teams run as well, has increased tremendously. So, this is just an idea. The number of beds is actually more now with Winthrop. So I'll talk about that as well when I talk about expansion. Next slide. We're also an academic medical center. We're not just a hospital point of care. So everything we do is really a confluence of research, patient care, and education. They all affect each other, whether it's training residents to actually treat as an inpatient rounding, or we actually get really involved with our researchers and our residents in designing systems, and really, because they're rounding and they're doing research on things like length of stay and how pain management and cessation programs work, and how we would affect that in an inpatient setting. So all of this is connected. Next slide. So MyWall. So I might slip into our vernacular, so apologies. We call the Oneview system MyWall. It was something we wanted to sort of give it a name, if you will, so that we can sort of give it our own color and spin. But how we got into this, a little bit of the lead up around creating patient-centric experiences is what got us here. And what started us on this pathway was we knew that we were going to build a 500-bed new hospital on the East River, and we wanted to go big. And we really wanted to create a state-of-the-art hospital. So for 5 years, we planned, and we planned for everything from robots delivering medications to a fully integrated clinical system. And really, we didn't want to just have IT roll in and do that and say, this is what's going to happen, and here's your new systems. We really did what's called user-centric design and spent a lot of time with the patients, understanding their perspective from what they needed, and for the clinicians, what would affect their care and not make things worse for them, essentially. So in our shopping, we came across Oneview. I believe it was at one of the HIMSS presentations, and we got into talking with them, and we selected them mainly because of their openness to change and their desire to partner up and really not just create a one-off for us, but have us as well as influencers as well as their other constituents and hospitals. We didn't want to just have a company that would take orders from us or just deliver us software. We wanted to actually be involved in the thought process. And so from the very beginning, we started to design this system that you see here on this screen, which I'll just give a quick overview of what it is. We call this MyWall. This is all running on the Oneview system. And what you see here on the top right here is a foot wall with a 72-inch screen and a tablet over here on the left. And both of these are integrated with a number of systems, all running off the Oneview platform. And at a high level, what we're doing is pulling information from the patient treatment team, integrating with the food ordering, integrating with the EHR for education. So, so patients can understand their care or families can understand their care, and really education, entertainment, relaxation. That's for the family and the patient. And this is not a nice to have. We have found this is essential in their care and treatment. So these bullets on the left are really some of our principles. We really wanted to create a healing process experience. So not all rooms or hospitals can afford to have a 72-inch screen, and that's okay. I'm going to talk about that a little bit, but our thought process in that was to create an environment of healing. So we do find in a lot of these rooms, people just have nature sounds on, or in a lot of the pediatric rooms, you have, music and sort of, oceans or forests in the background, and it really helps them sleep, or it helps calm the whole mood. So it's not just about engaging with the system, it's also about creating an ambient effect. And of course, supporting the family. So one thing I will say that was very interesting is having both a tablet and a screen, and the ability to do that gave us the ability, especially in most of our cases, we see someone comes with a care, someone part of the care team might be the wife or the mother or the father. They are there for sometimes, 12 hours a day. And so they need to be doing things, charging their phones or watching their own Netflix. So we do offer that capability. And of course, satisfaction experience. So I think I'll talk a little bit about the features of what we have with our, what I would call the premium platform. And I know, Niall, you're going to go into the sort of like offerings you have. If you can just go to the next slide. So this is how I would describe the system. This is what you'll see if you just have a tablet in your room, or if you have a tablet and a footwall screen. But this is essentially the primary interface. And this is, again, all built on the Oneview platform. We skinned it a little bit. We added a little bit of a New York background there, and have some of our logo customization on there. But essentially, what you're seeing here is a confluence of a whiteboard, what previously used to be a whiteboard in a room. You've got the care team on the left. So this is important for patients. They're sitting there in their gown and people are walking in and out of their room. Who are these people? Or, you want to thank that person that came along. And this was really important. We're not taking advantage of one of the features of this with Bluetooth, where you can actually, RFID, where you can actually kick off an alert to show that the person came in. And that's mainly because of our badging system. On the right-hand side, these are quick access things. We are working, I know Oneview is also working with the future of this, which would be at a glance, things that would be coming up in your EHR, like an appointment or who's rounding on you. But right now, we do see a lot of people going through their goals. Pain scale is something that they want to access very quickly, especially on the post-procedural units. And then, of course, my assigned learning is something that we want to really drive people to. So other aspects of this, I talked about on the bottom left, you see this My Health and Learning. Let me skip over order of meals because I have a slide for that next. Watch and Relax is really a whole slew of entertainment and relaxation. Oneview has provided access to a swank TV movie system for us. So that enables us to pick channels, just like in Virgin Atlantic flights, and have TVs streaming. And I think last year, Crazy Rich Asians and Still Frozen is still pretty high. And people are watching a lot of meditative and other things. We also, with Oneview, were able to do a couple of things with TV. One, we are showing TV on the big screen, but also now on tablets. And we're piping that through through, they can actually control the channels with the pillow speaker or the tablet. And we were able to create a feed from different places like the San Diego Zoo or our own in-house studio for like puppet shows. And when we have celebrities come on site for the kids, they sing and whatnot. We actually had The Rock last year. Dwayne Johnson came last year, and a couple other, I think Mariah Carey came for Christmas. So at the bottom, I'll talk about Adjust My Room on the next slide. Talk and Connect is very interesting. We don't offer TV. We don't offer telephones in the rooms. So we actually created, using the Oneview platform, because their platform is also on Android tablet, we created the ability for patients to call and connect. And I want to talk about this when I talk about the COVID, when Oneview's response to COVID and how we really accelerated and got into our ability to provide Skype, Zoom, and telehealth. So with this platform, we always have had the ability to provide telehealth services. So that Talk and Connect button, when you click on that, you can also, as a physician, if you're in the room rounding, use Jabber and connect with any other physician that you have the access code number to, or vice versa. You can have a multi-party conference. So this was used a bit, but not as much as we thought, until COVID came along. And then it was, everyone wanted to use it. We also had access to Zoom, and most recently added, we had access to the Microsoft Skype, and we just recently added Zoom. So that is an important component, especially when COVID came around, when you can't have visitors in hospitals. We were providing the means for patients to actually, have those end-of-life conversations or reach out and talk to their families. And that was essential, and really was a huge relief for us that we had this set up in place, that we had already facilitated this. So I think if you could just go to the next slide, Niall. I just wanted to get into some of the more nuanced things. The system on the left, you can see, is integrated with multi-languages, and we pull that directly from our EHR. And that's an important, this is a very light slide here, but it's a very important point. This integrates with our electronic health record system. And I'm not going to get too technical, but it integrates with an HL7 feed, which means that any event going on in a hospital, I could essentially integrate with this system. So what languages they speak, what their diet orders are, what their education requirements are, is all coming upstream from the care team or the system. And it just is a continuous experience that flows into the Oneview product. So in this case, I don't know offhand, I think we have 15 languages now, but this was a game changer for us. In New York, we have an incredibly diverse population. So the ability for us to do this for people who are coming in and scared and, post-procedural, they're operating a system, and now they can see it in their language. So that was great. On the right-hand side, I'm just sort of going through some of the major features here. This is a system we built with Oneview to integrate with our room and lighting. And this is, I would say, one of the more advanced features that you wouldn't necessarily take in the basic packages, but it is very popular. If you've ever been in a hospital or had someone in a hospital, having someone come in and open the shades or turn on the lights is a constant, I'd say, constant aggravation for the care team, but also for the patient. You're not empowered to do things. So this was a game changer. They can open up their blinds, they can go into dark mode, and they can control the temperature. So all of these were data points that Oneview can integrate into standard temperature, shade systems, and lighting systems. So this was really interesting for us. And I'll say that really the ability for us to empower the patient to do things on their own, whether it's change a channel, adjust the room and shades, was really a game changer for us in patient satisfaction. And one thing, there isn't a slide on here, one of the other main features is we integrate with the meal ordering system. So they can place orders, and the orders will be placed downstairs and delivered upstairs. So that's very popular. And it gave us the ability to really overhaul the efficiency of our inpatient facility operations as it pertains to food delivery and timing of food and such. So next slide. So this slide is just a trigger for me, and I'll say, you know, it makes me very happy when I see this slide. So I'll sort of shift. Everything I just talked about, we started 2 years ago when we put up this Kimmel Hospital, and it was an incredible experience. If you've never put up a hospital before, you know, it's like a wedding. Everything that's going to go wrong goes wrong between the construction and the you know, the power and the, you know, everything, you know, and so it was an experience to really deliver a product like this and get it rolled out to 500 beds. And now we have it to about 800 beds. And 2 years go by and COVID hits. And, you know, I know, you know, I'm speaking to everyone here internationally, you're all experiencing this and how this has affected your lives greatly. And from a healthcare system, it really rocked our worlds. I'd say we were very well prepared from a digital infrastructure capacity with Oneview and with our telehealth capabilities. And you know, our first priorities when COVID hit was really mostly around messaging and getting people information they need to know around visitation, but also really flipping our capability from an ambulatory setting to virtual visits. And along came the idea that some guys had with Cisco, and they were going to roll in all these iPads into rooms and just have Cisco on a stick so people can call in. And, you know, I got peripherally involved in this, and, you know, I said, okay, that's great. Wherever we don't have this capability, let's do it. And I think it was on a Tuesday. I've got an email from LaShawn, who might be on this call, and she said, "Hey, Mike, Oneview's developed a solution that we think can help you." And I said, "Okay." I opened it up, and lo and behold, what you see in front of you was a version of their product that was developed in the cloud to be a turnkey solution that could be delivered what I would call almost instantaneously. So we're in the height of, I think, March COVID, and we came across two major problems or problem statements. One was we wanted to reduce access to clinical rooms by clinicians to reduce infection exposure. So that was a problem. We wanted, you know, every time they go in a room, they have to don and doff, and maybe it's just a check if someone needs water, or it's just a check. So just that check-in, the contact hours were a concern. The second was, as you all know, and most of your hospitals in your local areas, visitors were a no-go. So what wound up happening was people were getting a little crazy and wanting to see their children or their loved ones who they had no idea where the access was. So if you can see here, a couple of things right out of the gates that were delivered in the Azure cloud, you know, which isn't just software. So Oneview also came up with a pipeline delivery for us in Ohio to ship Samsung devices, and a strategy to get them to us so we can go through a startup procedure. I have to move out of the sun here. Let's see, probably this direction. A startup procedure to get this loaded. And what I was talking about earlier was the fully articulated Oneview experience. I call this MyWall Lite, and I think, Niall, you have a marketing, sorry to the marketing team, but that's what I've been calling it, the Lite system, because it really is. I can roll this into a unit in hours. We rolled this into a Brooklyn building with 80 COVID patients in a matter of 4 hours on a Saturday. And lo and behold, within hours, they were talking to their loved ones. They were watching Netflix. Amazon gave us a nice deal to get a free Prime for these patients. And we changed, you know, we didn't change the course of COVID, but we certainly alleviated the contact hours, the frustration with family and entertainment. And, you know, I like to think of that as readiness to innovate to scale. And this strategy that that Oneview has really in their engineering and architecture adopted is thinking, what are the different variations? So if you can go to the next slide, Niall. This is really a concept that we like to talk about a lot: build to scale and operate. We can't predict all of the innovations that we're going to need. We can't predict all the problems tomorrow or the next day. But if you build foundationally with the ability to scale, you can roll out to very large ecosystems. So for us, COVID is obviously a top of mind, but we're hoping that as it wanes and we see a much smaller footprint of it in our hospitals, we're back to business. I mean, people are still sick. So for us, that's really just a variation of what we're doing with this platform. We want to roll this out to our entire 5 hospitals, and really just from left to right here, the drivers of those expansions and rolling out is, when a new construction goes up or we want to get new cable TV in there, that might be actually the driver. So it might not be, because they want education. It might not be because they want to do, rooms, lights and shade, or might not have that capability. That's okay. There's a minimal viable aspect to this, which is really entertainment. And then the next level up is always going to be meal ordering. They usually want to operationalize that. So we also take this product and create variations for different patient experience projects and needs. So for us, there's an array of patient experience areas. If you're talking about obstetrics, right? You have new moms coming in. They have a very specific need around meal ordering, entertainment, and lactation, education, and video conferencing about their new baby. You talk about someone who just had hip surgery. They have a very different experience. And what we need to understand with our experience officers, with our clinicians, what are the needs and what's the particular configuration that we would need to do to expand this product line into these places. So, on one hand, I know that I can get the light solution in with a tablet, a suitable Wi-Fi, and access to a suitable Wi-Fi and a tablet. That in itself might be a challenge for some hospitals, right? So for Brooklyn, we bought a hospital, I think 2 years ago, and the network infrastructure is from the 80s. Whereas with Kimmel, it's a fiber optic pipeline all through the building. We can pipe HD in there. So we needed something that could scale up or down, and that's I think where Oneview came in as a partner to help us. And I think we're not, they did it in a way that we're not the only customer that needs this. You might just need the light or the medium or larger. So I think next slide. So I just wanted to show this. So maybe it's out of order, but this is what you could see here on the left. These are our clinicians on the left during COVID, and this is 17 West. And that's actually one of the tablets that we had deployed for COVID. And what they have there is actually an iPhone, and they can call that tablet. And we actually just configured it so that the patient didn't have to press answer. They were just on screen in the room. So if you're very sick or ill with COVID, you can't actually touch the screen sometimes. So this is really virtual rounding. And we had given this access to I think 800 rooms had this capability. We scaled this back. Most of these now have the full education, entertainment, and sort of the MyWall light. But this is just sort of a visual to sort of tell the story here. Next slide. I think that might be okay. So I think just in summary, I think what we have is a platform and a partnership. And what my goal has been to do is to help leverage this platform in such a way that I'm not just churning it out in different locations, but we're adapting it and we're doing it in a way that satisfies our goals for clinicians and of course patients. And that's really what I think, the story that we're telling here is that partnership. So thank you.
Thanks, Mike, and thanks for your partnership. And thanks for taking the time to join today and share that story with us. We will take questions at the end, so if you have questions for Mike or for myself, please use the Q&A function in Zoom to submit. And even if we don't get time to cover all of those questions today, we will follow up afterwards, so please get those in. So I think this crisis has shown that it's impossible to predict the future, certainly with any level of accuracy. But we see 4 trends happening now and next with our customers, with the market, that represent opportunity for Oneview. So I'm going to talk about these first and then our strategy to respond to these. The first is the accelerated adoption of virtual care, whether it's in the hospital or for virtual visits at home. Virtual care adoption has really exploded during the crisis, and anyone watching the share price of companies like Teladoc will have seen that. For almost all of our customer base and for many of our open opportunities, virtual care is a top priority. And I think the speed at which the crisis has unfolded has meant that many organizations have really had to respond with tactical solutions. So, NYU have made the investment in that strategic infrastructure that enabled them to respond very quickly, but not every hospital obviously has that in place. And we've seen anything from baby monitors to the use of nurses using their own smartphones to FaceTime with family members for someone who's at their end of their life because of COVID. We've seen tablets, from well-intentioned donors literally sort of landing in hospitals who don't then know how to operationalize those tablets. So everyone's trying to help, but really as the crisis continues, systems are now looking at, what strategic infrastructure do they need to properly operationalize virtual care. Thinking about security, scalability, reliability, what you need in order to rely on technology in the enterprise. I think the second trend is around financial pressure. So as Mike mentioned, that the fact that elective procedures, which are the revenue engine for private healthcare providers, have really been off, for months this year and are really not fully on yet, has led to the loss of billions of dollars when you look at the US healthcare system. And healthcare is famously nearly recession-proof. People will always need healthcare. But even amongst the sick and at risk, there's been a reluctance to seek medical treatment because of the risk from COVID. And we've seen this lead to capital projects being deferred, and we're seeing capital budgets under pressure. This is something obviously we've covered in our latest 4C filing, in terms of what this has meant for our own expansion projects, some of which have been deferred into next year. As with the broader economy, I think the long-term effects of COVID are still unclear. People are always going to need healthcare. But those revenue shortfalls are going to mean spending curtailments, and capital will be preserved for the highest priority projects. And I think this leads us to the third trend around resourcing pressures. So during the crisis, healthcare systems have furloughed staff, have laid off staff. Hospitals lost 2% of staff from February to April. And while many other healthcare settings, dentists, for example, recovered jobs in May, hospitals continue to shed staff, and we expect that IT and operational resources are going to be stretched. And this is going to be a factor when it comes to project prioritization, what hospitals can actually deliver in the portfolio with the resources that they have, and procurement decisions. And then a product survey that we ran recently with customers and in the market, nearly 2/3 of recipients or respondents, said that implementing tools or processes to enable care to be delivered with fewer people or more efficiently was a top priority. And then the last is cloud adoption. I think the COVID crisis has really emphasized the importance of cloud characteristics, so scalability, resilience, but most importantly, responsiveness. As Mike has talked about, our ability to respond on cloud, was in the days, rather than weeks or months. And we're seeing real interest from our customer base, from prospects in cloud, and I would say probably a new willingness, I think, to consider cloud and an understanding of the benefits of cloud. I mean, people have seen this in their the private lives and the professional lives. For example, just in terms of the adoption of cloud-based collaboration software. And with the NYU team, they've seen the speed of software updates to the cloud. We've been able to deploy updates to our cloud solution in days that would have taken months, with the best will in the world with on-prem software upgrades, because of the process that we need to go through from a deployment perspective. So how are we responding to this? Well, there are two key strategic goals which we are focusing on. So the first is making it faster and easier and lower cost for our customers to benefit from this digital infrastructure at the point of care. And that's it's about removing the friction, reducing the friction for closing deals. It's about shortening the sales cycle, getting customers onto the first rung of the ladder, as Mike talked about, helping people start, even if it means starting small and then growing, whether it's growing through expansion or growing, by adding functionality and additional integration. So cloud makes it easier for customers to get started. It means that we can deploy in days, not months. And because we're managing the infrastructure and the overall process is faster, we also need less resources from our customers. So we've done some analysis around this, and we think that up to half the resources that were required on the customer side in the past, that we can save those. And ultimately, that obviously leads to a reduction in total cost of ownership for our customers, and it also reduces the bar when it comes to what projects are actually prioritized for delivery. And then between cloud and lower cost Android hardware and the reduced effort to implement and operate, we can bring down total cost of ownership. And our analysis shows that we can deliver up to 60% on capital expenditure between less server infrastructure, saving the professional services, customer resources, hardware. And then when you look at the total cost of ownership, around 20%, and that's even when you factor in an increase in per diem to reflect the operating costs of cloud. So obviously we have operating costs, in terms of Azure, in terms of the resources that we need to operate that cloud. And then this also really importantly means faster feedback loop. So from a product perspective, we can release software faster, we can deliver increments rather than big bangs, and we can get feedback as well from our customers. And Mike talked about, the importance of partnership, as we innovate, and that feedback loop and being able to iterate, without having to wait, 6 months or a year to be able to deliver new software is really important. And that gives us a competitive advantage in agility. And we've seen how important that agility has been, as organizations have had to sense and respond during the COVID crisis. And then I think the last point I'd make just around cloud is that this gives us greater flexibility when it comes to market entry. So we use Microsoft Azure, that's our cloud platform. We're already approved for co-sell with Microsoft Enterprise sellers. And reducing cost and complexity makes it easier for us to go to market with channel partners. And thanks to Azure's regional coverage, we have the flexibility to support new markets where that makes commercial sense. And then the second goal is really around enhanced value for our customers. And this isn't a new strategy. When you look at the growth strategy that we presented in our annual results presentation for the last financial year, this was, a key part of that strategy. But we're really beginning to see, I think, the power of the platform. We onboarded Caregility as our first value-enhancing partner on the new next-generation Android platform this week. And we're working through the first release of our patient feedback app that will enable patients to provide feedback on their experience through the Oneview system. And this, I think, is probably the most requested capability from our customer base. And it's something that we're really excited about because this will enable the measurement and management of patient and family experience in real time. And then we're also continuing our strategy to enhance the value proposition for our Epic customers. So this is all about driving enrollment and engagement with the patient portal. This is really important. I mean, when you look at our US customer base, it's almost all Epic customers, and approximately half of our target market is Epic. So I just wanted to talk a little bit about our product structure. So Mike alluded to this when he spoke about MyWall Lite. So this was how NYU thought about how they could simplify a version of MyWall for appropriate points of care. And so we are updating our product structure, how we package and sell our product, to make it easier for our customers to get started, to support smaller deployments from the cloud, and also more tailored solutions, and ultimately to give us greater scope for upsell with Oneview and partner apps. So under this model, we'll work with customers to select an appropriate platform tier for their needs. So we're moving from a scenario where we had essentially one platform, one tier, to offering 3 tiers in the cloud and 1 on-prem. And they can start, with one of the earlier tiers, and then they have an upgrade path, as they scale, whether it's expanding the number of beds or adding more complex integration or functionality. And then they can also opt to add Oneview apps or Oneview partner apps like the Scalability solution. And we're also able then to deploy third-party apps, as we've done throughout the COVID crisis for video, so as we've done for things like Zoom for Cisco Jabber. I'm going to talk a little bit more about the cloud tiers on the next slide, but just wanted to highlight the importance of the partner apps and content components. These are apps and content where we have a commercial partnership, and Android really gives us the flexibility when it comes to apps to be able to deliver, and this is really a key reason why we have moved to the Android platform, as well as it being lower cost. And then we've also identified 4 problem domains that really contribute towards improving the care experience for patients, families, and caregivers. So our current apps and solutions align to these, and this is really going to help us focus our product development in the future, and really more importantly, help us frame a compelling value proposition for our customers and prospects. So cloud really is key to that faster, easier, and lower cost strategy. We're creating those 3 tiers for our cloud platform with increasing levels of functionality and integration. And there's really a couple of drivers for this strategy. The first is that it allows us to start offering cloud solutions before we've actually moved the fully integrated platform to the cloud. And then the second is it gives us pricing flexibility, because rather than having a one-size-fits-all model, we now have tiers that allow us to price accordingly for the tier, for the functionality, and for the customer. And we've really been able to leverage this model to better tailor solutions for opportunities, particularly outside of the US market. So in Europe, for example, our Cloud Advanced tier was a better fit for a prospect's initial needs than our full platform. But they needed the upgrade path for the future, as they wanted to add that electronic health records integration in the future. And similarly in Canada, the Cloud Advanced tier also enabled us to respond to an opportunity that required bedside tablets. It required an automatic data wipe of tablets when patients were discharged or transferred, but they didn't want to have the full EHR integration, although they wanted the option to have that in the future. So the first tier is CXP Start. CXP is a cloud experience platform. This is how we're rebranding the product suite. And this is the solution that we've launched during the crisis. So we launched this as Cloud for COVID. This is what we've deployed with Mike and the team at NYU. But we're formally relaunching this offering in the market with this new branding in September, although we're already using this in proposals. So this is a managed tablet solution. It's aimed at areas within a large hospital, smaller hospitals. It's not integrated with the electronic health record, and this is really because it makes it faster to deploy and also minimizes risk, as there's no patient data in the cloud. And this solution enables hospitals to deliver apps, content, games, education, movies, and calming content at the bedside. And with our Scalability partnership, we're now able to bundle the iConsult bedside solution, and that really gives us an end-to-end capability for virtual rounding and virtual visitation. And then CXP Advanced, which is going to launch early next year, will be the next step up. So this will enable us to support tablet, TV, and all-in-one devices. It automates the device wipe, so between patients the devices automatically restart and wipe, and it also adds some additional functionality. So we expect this to be suited to customers who are maybe deploying in a single hospital, perhaps as a precursor to an enterprise rollout. And then finally, CXP Enterprise. So this is our fully integrated platform. This is what we deliver on-prem today, but this is moving that full capability into the cloud. And because that means storing and processing patient data in the cloud on behalf of our customers, we've got work to do to implement the technical and organizational changes we need to manage this new risk. And therefore, this is something that we expect to be able to offer in early 2022. Although we're currently looking at options around how we can accelerate this. And then also key to faster, easier, and lower cost is reducing the capital cost of our hardware. As many of you know, we've been pursuing this strategy with our next generation platform. We've spoken about that before, obviously. But our Android devices are beginning to come on stream. And as they do, we're able to start deploying new Windows devices. And this is really delivering savings for our customers as they expand and move to our next generation platform. The Samsung tablet is supported today. This is the device that we've used at NYU Langone, 70% cheaper than the equivalent Windows device. We announced our strategic partnership with WeTech earlier in the year, and I'm happy to say that we'll be delivering our first Android set-top boxes to customers in Q4 of this year. And this is really a major milestone, and that cost reduction against Windows just highlights how important this is from a cost reduction perspective. And then the second phase of that partnership will be delivering the coax box in 21. This enables us to deliver OneView at the bedside for hospitals, even when they have legacy coax infrastructure. And this will help unlock both expansion beds in our customer base, as well as being table stakes for some of the enterprise customers we're talking to. And then finally, we'll be delivering the 22-inch. This is our large touchscreen in 21, and this is also key to standardizing our existing customers on our next generation platform, as well as enabling new business. And this is particularly important in the Australian and Canadian markets, where they favor that format. I'm just going to talk about this very, very quickly. I'm conscious we're getting close to our time now, and I want to keep some time for Q&A. But we were happy to announce a partnership with Caregility this week. Some of you may have seen the press release that went out yesterday. So the automatic lights here in the room are going off. And this is a relationship we've been working on over the last couple of years, and we've got to the point now where we're able to operationalize it. And Caregility are a telehealth pure play. So unlike some of the other enterprise collaboration vendors who offer solutions for the enterprise and have sort of taken those and adapted those for the healthcare setting, Caregility is built ground up for healthcare use cases and healthcare workflows. And this partnership is going to enable us initially to offer their iConsult bedside solution for virtual rounding and virtual visitation on tablets. But we will then be integrating that into the television experience in the future. I'm just going to talk about this very briefly, and I think then we'll move on to Q&A. I just want to talk about this as our vision for the hospital room of the future. I think a question for all of us is how quickly will hospitals implement a system like OneView? And we see lots of futuristic visions for the smart room of the future, the hospital room of the future. But when it comes to the legacy buildings, the legacy infrastructure that make up much of the healthcare real estate, these visions sometimes feel a bit disconnected from reality. It's fine if you're building a new hospital, but not necessarily practical for existing hospitals. So we've thought this through and developed a roadmap based on our discussions with our customers, with other people in the market, around how healthcare systems can move towards the room of the future in a pragmatic way. And we really see it as three high-level stages. So the first is, it's possible today. It's about equipping rooms with tablets, that bedside infrastructure to enable virtual care. So communication with the care team, with interpreters, and with family members who can't physically visit. This is what we're offering with our Cloud Start platform and with our Caregility partnership. And we really believe that this technology is close to crossing the chasm. And then the second stage we call connected care. So this is really around using the television screen in the room for seamless communication with the care team, with the family, using high-quality cameras, microphones with night sight, and the ability to control the camera. And this really enables new models of care. So it enables telenursing. These will be remote caregivers who are a virtual member of the care team. So they're managing non-physical aspects of care, working with the physical nurses, monitoring patients in a hybrid model that is more efficient than just physical nursing. This is something we see as medium term. And then the third stage we see as we would call smart care. So again, this is something where the technologies exist today. They are developing, they're getting better daily, the technology is becoming commoditized, but we still expect this to be a longer play when it comes to adoption as healthcare systems, patients and caregivers become comfortable with artificial intelligence, with things like voice assistants and sensor technologies. And with this smart care technology, sensors, voice assistants in the room can monitor and enable patients. So this enables offloading to virtual or to physical care team members where required. So for example, if a patient who's at risk of falling is determined by a vision sensor that's constantly monitoring the room, and that detects that they're preparing to exit the bed, the OneView system could display a visual and an audio warning, to stay in bed, and would then also automatically alert the closest care team member who could come into the room and help the patient. So this is really all about the power of digital infrastructure at the bedside, and of this platform that we can grow with our customers as we deliver new value and integrate new partners. So I think we've got around 8 minutes left. I had a little more content to go, but I really want to leave time for questions. So Kai, do we have any questions that we could address?
We do. So I've got my first question is for Mike. I know you've typed in an answer, Mike, but it'd be great to hear you talk about it for the broader benefit. What is the likely relevance in the context of day surgeries? Would post-discharge follow-up / recovery at home with Oneview be an option? BYO devices.
Yeah, so I think, one of the configurations we have in the day surgeries is we have the units in the wall, and before their surgery, as they're waiting, they're using the Oneview. Actually have it behind a TV mounted in the ceiling, and they're able to watch TV and movies, and also order food when we have the longer blocks. But essentially, yeah, it's they're sitting there for hours. They have nothing going on, and in some contexts, when there's education or conversation around the education, that's where we were looking to bring in the ordered education as well. So you can see that right on the screen.
Great, thank you. Next question, possibly for Niall. Is there an opportunity to broaden the scale to GPO or IDNs?
So from an IDN perspective, I mean, we have customers today who are IDNs, Bonds Jewish, for example, in Missouri. When it comes to group purchasing organizations, which are GPOs, we have had discussions with group purchasing organizations. So essentially they work on behalf of hospital networks to act as, essentially sort of procurement agents. So that's certainly, an area where we think there is potential. So yes, I think that is certainly something that we'd obviously be interested in pursuing and are having conversations around.
Thank you. Our next question is, comment first. Congratulations. Wonderful to see the fabulous progress, but also the agility and flexibility. 2 questions for Mike. How did NYU manage digital literacy for both patients and staff, particularly those from vulnerable groups, such as the elderly, mental health and blind? And have you completed a formal evaluation of the implementation, particularly the ROI or the financial impact of better patient and staff experience?
So thank you. I think the first one for the digital literacy, I think this is where I think when I talked earlier, when we designed the solution to implement this, we work closely with our care teams and our nursing and education. So a lot of the education is designed with that in mind. So really we're using MyWall as a venue for it. As far as the user experience goes, we really spent a lot of time in usability. And as we were designing the skin for the Oneview, we were actually rounding with tablets in patient rooms and asking them real time, what did they think? So we did a lot of interaction design in the context of the inpatient setting, so that the interface was designed very thoughtfully. Everything from the lights and shades to how they navigate the system was done with iterations with actual prototypes. And then we were able to just skin that on top of Oneview in a configuration that was best. And I think, that's plays to the flexibility. I think that was the first question. Was there a second one there?
Second question was about if you've done a ROI evaluation.
So a comprehensive ROI, we have not. Where we have been aligning this program to is around patient experience, satisfaction, length of stay, and other things. So for example, we can show the estimated discharge on the screen, and we can provide education and ways to help people navigate to get them out. Those are our goals around, so we're mapping it to goals, not necessarily revenue for us. And that's really attributes to people wanting to come to the facility in the hospital. So in a way, it really, our principle was we need to do this for experience first, and not just for the patient, but also the clinical experience. So we are mapping it to those, but not a direct attribution to, because we're not charging them for this. We're not charging the patients for this. That was our model.
Thank you. And another question for you, Mike, is could you tell us more about improvements in clinical outcomes?
So, I think that's something that that's a great question. That's something that we haven't we'd have to do measurement and study on. We are looking at ways to integrate more improved pain scales, and different things around showing events that are coming up in your day so that you can be better prepared. But essentially, the clinical outcomes are really the total ecosystem of the EHR for us and the care team. So this is integrated. Who your care team is, what your education is. These are core things that integrate with your clinical experience. But as far as outcomes go, that's not something that we directly attribute to the system.
Thank you. I have a couple of questions for Niall. So first of all, can you give us a feel of your penetration for Oneview around the globe?
Yeah, sure. So, from a market focus perspective, at the moment, the US market and the Australian market are strategic markets. We also have customers in Asia and Thailand with Bumrungrad International, and in the UAE as well with the Mediclinic International Group. And as I mentioned, I think with COVID, we've obviously seen the same needs that we've seen in the US market and the Australian market. These are universal needs. The reason that we focus on those markets is because of the maturity of the markets in terms of technology adoption, particularly EHR adoption. But I think the COVID crisis has shown the universality of the need for bedside infrastructure, and some of those opportunities that I spoke about, that are opening up now. I just referenced one in Canada and one in Europe as examples. And I think those are interesting because, those healthcare systems are coming to us, even though they don't have fully EHRs in place, and even though they're not looking for fully EHR integration at this point, and saying, we have a need, and that's a need that we're able to meet, with those sort of, lower tiers of our platform in our new model. So I think we're beginning to see, the universality, really come into play.
Great, thank you. I've also got a question around where your revenue is derived from, or rather, who is the payer for this? Is it healthcare insurance, the hospitals, the sellers, the patients? Just trying to understand the affordability of this type of care.
So our revenue is derived from the healthcare system. So the hospital is our customer. Obviously, they're deriving their revenue from health insurance, whether that's private or employer or federal. But our revenue is not coming from health insurance companies. So hopefully that answers that question.
Just one comment on that. We do see a cost savings as it pertains to saved contracts on expensive TV providers and cable companies. So wherever you may be, what that fee might be is also something you can eliminate by pulling this in.
Great, thank you. Got to follow up to an earlier question, which is: are you more likely to target smaller, more localized GPOs, or larger Vizient or Premier types?
Yeah, look, I think obviously the larger ones are interesting because because of the size of their network. So I think the other point I'll make about GPOs is GPOs, as procurement agents, are all about simplicity. So it's about SKUs and simplicity. And I think that the way we are moving to this new product architecture and enabling more tailored solutions, but those are product units, if you like. We can almost put SKUs against those, and with the cloud delivery model, I think that sets us up better to be able to partner with GPOs to deliver the solution. I think that's also true with channel partners as well.
Thank you. And another question: what can you do with the data? Can you leverage that as a separate offering, or can it be used internally as a feedback loop?
Well, I can certainly answer that from a product perspective, but Mike, I'm interested in your thoughts on that, from the customer perspective.
So that's actually interesting. That's been our discussion in the past couple of weeks. We're hooking up all of our data into Tableau so that from a heuristic capability, we can gain insights into a couple of things. One is just the efficacy of our training programs. That's important. As it pertains to patient education. The second is the robustness and utilization of our meal ordering and operations. And then other aspects just of general usage and usability. That's really important for us so that we're not just cooking up ideas. With Oneview, we can actually have a feedback loop into, what are people doing? We were surprised by the amount of people using the lights and shades, for example, and we were surprised by the amount of people using the relaxation system from the meditative stuff. So this was really important for us as a data-driven feedback loop rather than anecdotal or patient surveyed.
Yeah, and I think just to add to that, I think we've put a lot of effort into our data platform. So our data platform is cloud-based. It supports all of our customers today and will obviously support new customers as we deploy in the cloud. And that allows us to aggregate data. It's anonymized data, so it's not identifiable patient data. But by bringing that into the cloud, we're able to offer near-time insight to our customers in terms of how the system is being used. And obviously, that's really important to us as well from a product perspective. In terms of understanding, where we need to be focusing. And as we scale our customer base and our data grows, I do think that, we will have the infrastructure that will then allow us to start thinking about, how can we productize that or how can we create value from that data for our customers. So that's absolutely something that we're thinking about.
Thank you. Another question for Mike. Can you give us a feel for the competitive landscape for the Oneview system? Who else did you consider?
So, we had, I think, we had a couple of competitors at the onset. What's interesting about this space is you've got Epic as an EHR that offers, at least in the US, it's a very widespread EHR. That is our EHR. It offers a very lighter version of this. We actually integrate MyChart into Oneview. So that was something that we were considering. And Niall, we were talking about the other day, what was the name of the vendor? Care, what was it? Care, the one that we didn't pick. It was 3 years ago. There wasn't a very large landscape, so to speak, in this. And if you go to HIMSS, if you go to these different road shows, no one's really delivering a core base capability that integrates with an EHR. You'll get education, you'll get entertainment, but there isn't anyone that I saw, at least in this space in the US, that I could do this with. So it's not unique, but it is very niche.
Thank you. Got a couple more questions. Do you have any links to patient experience and patient-reported outcome measurement programs?
So is that for me? So HCAHPS is really what we look at. HCAHPS is important for us, and then that gets distributed after discharge. We, as far as reported outcomes, we also have our rounding. We have officers round and actually get feedback on mobile apps so we can get information there. So HCAHPS is largely what we look at.
Great, thank you. And I think this is our final question, and it might be for either of you. Do you have any experience with in-home care with the solution?
Yeah, that's a great question. So, and I think this is, again, where cloud comes in terms of opening up possibilities. So obviously, when we deploy on-prem, as has been the model, that supports devices within the hospital, within the hospital network. But as we move to cloud, we can deliver our solution. I mean, we can deliver our cloud start solution today outside of the hospital because that's supported by cloud. Now that's, not including patient data today, as I mentioned, and, on our roadmap to the full platform in the cloud, we'll have the integration that allows us to capture and to process patient data in the cloud. So I think cloud opens the possibility of, how we can, look at these tiers and think about, well, what other use cases could we support with this outside of the hospital? And then ultimately, I think as we get towards the full platform in the cloud, I think that, opens up even more potential, in terms of, how we can leverage the technology to support more of the care continuum. But certainly for the moment, obviously, we're very focused on how we can support our hospital customers and support patients and families during their hospital visits.
Great, thank you. Well, that brings us to the end of the Q&A session. So thank you, Niall, and thank you, Mike, very much for a great presentation. And thank you to everyone who's listened in. If you do have any further questions, do feel free to email us and we'll respond to you.
Fantastic, and thanks again, Mike, for joining us and
thanks,
taking
guys.
time out of your vacation.